Hi, I'm Valerie, a registered nurse specializing in wellness and health education with a focus on wellness and longevity. Over the years, I have helped hundreds of people improve their health with practical science based strategies. I have learned that some of the most important health habits are the easiest ones to overlook. One good example of this is oral health. Most people think of brushing and flossing as a way to prevent cavities or freshen breath. But the more that I have studied the connection between lifestyle and long term wellness, the more I have come to realize that your mouth plays a much bigger role in your overall health than most people realize. In this video, I will share what I have discovered about the surprising link between oral health and your heart, brain, immune system, and even how you age. I'll be talking about how chronic gum inflammation can quietly impact your body, the foods and habits that support a healthy mouth, and simple things that you can do starting today to protect your smile and your long term health. Let's start with the basic truth. The mouth is part of the body and is one of the main gateways to the rest of our system. Everything we eat, drink, and breathe passes through our mouth first. And the tissues in our mouth, especially the gums, are full of blood vessels that are directly connected to our bloodstream and the rest of our body. When the mouth is healthy, like when the gums are pink and firm, and there's no swelling or bleeding, it acts as a strong first line of defense. But when we have gum disease, what's technically called periodontal disease, that barrier starts to break down. Gum disease usually starts small, often as gingivitis, with redness or bleeding when you brush. And if it is left unchecked, it can progress to periodontitis, where the gums start to pull away from the teeth, pockets of bacteria form, and inflammation spreads deeper into the tissue. And this is where a more systemic problem develops, because that chronic inflammation doesn't just stay in your mouth. Inflammation is the body's natural way of responding to injury or infection. But when it becomes chronic and persistent, even at low levels, it can start causing harm. In the case of gum disease, the bacteria in your mouth trigger an ongoing immune response. This leads to inflammatory chemicals being released into the bloodstream. Over time, this can increase the risk of atherosclerosis, where plaque builds up in the arteries, narrowing them and making it harder for blood to flow. This is one of the reasons why gum disease has been linked to a higher risk of heart attacks, stroke, and coronary heart disease. But it doesn't stop there. In recent years, researchers have also found connections between gum disease and Alzheimer's disease. One theory is that the same bacteria found in diseased gums can easily travel from the mouth to the brain, where it contributes to the formation of amyloid plaques. These are the same plaques that are found in the brains of people with Alzheimer's. The effects of chronic inflammation from the mouth does not stop with the heart and brain. It can also impact other parts of the brain in ways that you might not expect. It places a constant demand on the immune system, which over time can contribute to the development or worsening of other inflammatory conditions. For example, research has shown links between gum disease and type 2 diabetes, where inflammation makes it harder to control blood sugar, creating a cycle that affects both oral and metabolic health. It has also been associated with respiratory conditions, as bacteria from the mouth can be inhaled, potentially worsening issues like chronic bronchitis or even contributing to pneumonia in older adults. And for those worried about joint health or if you are already living with arthritis, this increases the body's overall inflammatory burden. And this all adds up. It increases joint pain and possibly speeds cartilage breakdown. So, what is going on in your mouth can have ripple effects far beyond your teeth. And because gum disease often does not cause pain until it is advanced, many people do not realize they are living with this constant low-grade inflammation. By reducing inflammation in the mouth, you are not only protecting your teeth and gums, but also helping to ease the overall strain on your immune system and lowering your risk for these other health concerns. So let's start by talking about food, because what you eat does not just affect your weight or your energy, it affects the health of your mouth too. One of the biggest culprits when it comes to gum inflammation is sugar. When we eat sugary foods or drink sweetened beverages, the bacteria in our mouth feeds on that sugar and begins to produce acid. These acids attack the enamel of the teeth, leading to decay, but they also irritate the gums, fueling inflammation. And it is more than just candy or soda. It is also things like pastries, sweetened coffee drinks, and even some processed carbs that break down into sugar starting in the mouth. And here's something that a lot of people do not realize. Carbonated water, especially all these flavored sparkling waters out now, can also contribute to oral problems. While they might seem like a healthier alternative to soda, and they are, these drinks are still acidic. The carbonation creates carbonic acid, and some flavored waters have added citric acid for taste. Frequent exposure to acid can weaken tooth enamel and irritate gum tissue, especially if you sip on them throughout the day. That does not mean that you can never enjoy sparkling water, but it is something to be mindful of. Try drinking it with meals rather than constantly sipping and rinsing with plain water afterward, because this can help reduce its effects. On the other hand, there are foods that support good oral health. Crunchy vegetables like carrots and celery help stimulate saliva production, which naturally cleanses the mouth. Leafy greens packed with vitamins like folate and vitamin C support gum tissue. And green tea has natural anti-inflammatory properties that can help reduce bacterial growth. So what can you do to keep your mouth and the rest of your body healthy? Of course, brushing and flossing are the foundation, but they need to be done the right way and with the right tools. Let's start with something simple, the regular old toothbrush. Not all brushes are created equal, and the ones that you choose can really make a big difference. When it comes to protecting your gums, softer bristles are usually best. Hard or even medium bristles can actually cause damage over time, wearing down enamel and irritating delicate gum tissue, especially if you tend to brush aggressively. A brush with a small to medium-sized head will also make it easier to reach all areas of your mouth, including those back molars where plaque loves to hide. You want to brush twice a day for at least 2 full minutes each time using gentle circular motions, not scrubbing back and forth. The brushing along the gum line is key because that is where bacteria gather and where inflammation often begins. Now, while a manual toothbrush can do a perfectly good job if you use it well, some people find that electric toothbrushes offer extra help, especially if they struggle to brush effectively or tend to miss spots. Electric brushes, especially the oscillating or sonic types, have been shown to remove more plaque and reduce gum inflammation more effectively than manual brushing for many users. These brushes move quickly, helping to dislodge plaque along the gum line and between teeth. The supersonic versions take this a step further, using rapid vibrations to create tiny bubbles that help clean in hard to reach places. They can be especially helpful for people with sensitive gums, arthritis, or simply those looking for an easier, more thorough clean. And then there is flossing, which really does matter. Brushing alone can't reach the spaces between your teeth, and that's where food particles and plaque love to settle. Flossing just once a day helps remove this buildup and prevents it from turning into tartar, which is much harder to get rid of. If you find traditional floss awkward or uncomfortable, and many people do, consider a water pack. These devices use a stream of water to flush out debris and bacteria from between the teeth and under the gums. They are especially useful if you have dental implants or deeper gum pockets. While some people benefit from using both floss and a water pick, for others, a water pick can be a more practical alternative. And the best routine is the one that you will stick with consistently. And don't forget about hydration. A dry mouth gives bacteria a chance to thrive. So, drinking enough water throughout the day supports saliva production, which naturally helps cleanse your mouth and neutralize acids. And of course, regular dental checkups are essential. Even with good daily habits, plaque can harden into tartar that only a dental professional can remove. These visits also give your dentist a chance to catch any early signs of gum disease or other problems before they become serious. And like just about everything else that we talk about on my channel, taking care of your mouth is about more than brushing and flossing. Managing stress, getting quality sleep, eating a nutrient-rich diet, and staying physically active all support a strong immune system, which helps your body fight off inflammation, whether it starts in your gums or anywhere else. What I love about this topic is that it shows how everything in your body is connected. Your mouth does not exist in isolation. It is part of a larger system. And the small habits that you build around oral care can have a big impact on your overall health. By reducing inflammation in the mouth, you are helping to reduce the burden on your heart, your brain, and your immune system. You are supporting better circulation, clearer thinking, and even more stable blood sugar levels. And the best part is, these are things that you can start doing today. So the next time you pick up your toothbrush, remember, you are not just caring for your teeth, you are caring for your whole self. If you are ready to take charge of your health in a way that feels realistic and sustainable, check out my Thrive in 25 program. You will get immediate access to a complete, easy to use spreadsheet with 25 habit focused lessons, each one designed to help you feel better, move better, and support long term well being. Everything you need is organized in one place so you can start when you are ready and go at your own pace. There is a link in the description for this video if you want to check it out. If you found this video helpful, please give it a thumbs up and consider subscribing to my channel. I share practical, science-backed wellness strategies to help you live a healthier, longer life. Thank you so much for watching, and as always, please take good care of yourself.